6 University of British Columbia students led a project as part of our course in Working in International Health. Although we have different academic backgrounds, we have at least one thing in common: an interest in global health. We came together to form a project that would fall under the wide scope of global health. And what better way to address this issue than starting right here at home in British Columbia? We initially addressed our province's public health policies, which allowed us to identify great disparities when looking to our closest American neighbor, Washington State. Seeing the inequalities and flaws within the different public healthcare systems motivated us to look deeper at the policies and their various long-term outcomes. The United States currently remains the only developed country without a national policy providing paid and job-protected parental leave. The U.S. joins Suriname, Liberia, Samoa, Nauru, Palau, Tonga, and Papua New Guinea as the only 8 countries in the world that do not have paid leave for new mothers. The only national policy in the U.S. that currently exists under the Family and Medical Leave Act regarding parental leave provides 12 weeks of protected yet unpaid leave only to individuals who meet a number of criteria. They must be employed full-time for a minimum of 12 months at a company with over 50 employees. While corporate policies for paid parental leave can benefit American citizens, these are only available to 11% of the nation's population, which typically consists of some of the wealthier and more affluent families of the population. Those who are at the highest risk of negative health outcomes for their children often do not have access to such benefits. This lack of paid and protected parental leave has detrimental, lifelong effects on children and society as a whole. Research has shown that the first 1,000 days of a child's life, beginning during pregnancy and extending to their 2nd birthday, are vitally important in determining the risk of developing life-threatening diseases during childhood, the likelihood of graduating high school and even pursuing higher education, their future economic prosperity, and their chance of eventually having a healthy family of their own. The component of the first 1,000 days of life that is so influential to the rest of a child's life is access to nutrition during this period of development. The Center for Disease Control and Prevention, World Health Organization, American Academy of Family Physicians, and American Academy of Pediatrics all recommend at least 6 months of exclusive breastfeeding, which is often not possible if a mother is forced to return to work.